This short video is for wards 10, 12, 19 and neonatal surgical ward who are taking part in the fluid balance chart pilot. This video highlights the changes on these charts in relation to extravasation and enteral feeding. Let's look at the front of the A3 and A4 fluid balance charts first. On the current A3 chart, we document the length of the nasogastric or nasojejunum tube at the nose. This now has also been added to the A4 feed chart. This allows us to observe for any changes if the tube has moved. Now let's think about the checking of feeds before they are set up. At the moment, 2 people should be independently checking a feed and signing on the feed record as shown here. This applies to all feeds, whether the feed is being administered orally or enterally. This can be done with a member of clinical staff or the patient's parent. To make it easier to remember to check feeds and document this check, we have added a column on the feed and fluid charts here. This column is to be signed by both checkers and will replace the feed record currently in use. It is already policy for nasogastric and orogastric tubes to have 4-hourly gastric aspirate pH tests during continuous and overnight feeds. However, audit data has shown that this does not always happen. To help you remember, we have added a purple outline at the hours of 10, 2 and 6 as a prompt to complete a gastric aspirate pH test every 4 hours when a tube is in continuous use. The purple outline acts as a prompt. If your patient care dictates that you complete your 4-hourly gastric aspirate pH tests at different times, such as 8, 12 and 4, you can continue to test at these times and document them at the appropriate time you complete the test. However, the purple box is there as a prompt to ensure that gastric aspirate pHs are completed and documented a minimum of 4-hourly when in continuous use. All pHs that are carried out must be documented, including those which trained parents have completed. We are now going to talk specifically about extravasation. All patients with an intravenous line have an A3 fluid chart, so we are now going to look at the A3 fluid chart only. Our audits have shown that our line's daily record on the back of the A3 fluid balance charts are not always completed, and your feedback tells us that the current format is not user-friendly. We have simplified the reverse of the A3 fluid chart into AM and PM checks and made it easier to fill out. We have made some changes to the cannula checks section. We have reduced your workload so that you now only need to write the date of insertion and the site of the cannula. The rest of the cannula section remains the same as the current charts. The All Other Lines section also has some changes to make it easier to complete. Again, here you now only need to document the date of insertion and the site. We have simplified the chart by combining the biopatch required and in situ to 1 tick box instead of 2. In addition to this, the dressing and biopatch change next due has also been combined to 1 question. If we go back to the front of the A3 fluid chart, there is an addition of a tick box in the top left-hand corner. Once you have completed your daily lines record for the AM or PM, tick this box appropriately on the front of the chart. This will act as a prompt to all staff to complete their documentation on the back. When you are documenting the removal of a line or cannula, on the reverse of the fluid chart, you will find this section has been moved to the side of the daily line record, and we have added the option to write the site you are removing when completing this box. This completes the changes to the feed and fluid balance charts. If you have any questions, please contact the patient safety team.